Hi, everybody. Thanks so much for joining us. We're so excited to have everyone here tonight. Before we get started, I just wanted to say a little bit about Stay Home Watch Together and how it came to be. As you know, these are really challenging times for all of us, and the film industry has been heavily affected by the outbreak. This program came together as a way to continue to spread the messages of important film campaigns and inspire people to take action. Until April the 30th, we have a schedule of daily screenings and activities like this one. So if you hadn't yet had the chance to, please head to our website and check out the full program and see what's coming up, or you can rewatch some of our amazing films and Q&As that we've already had. We're so excited to have the team from Jackson with us tonight, so I'm going to hand back to them without further ado. Hand over to Kate.
Hi, so my name is Kate Smith. I am a reporter for CBS News, and I often am covering abortion and access to abortion. So I'm really excited to be here, have an excuse to watch this amazing film again, and have a chat with you guys. So do you want to start by the both of you introducing yourself?
Sure. Hi, I'm Maisie Perrault, and I directed and filmed Jackson. And this is Abbie.
I'm Abbie Perrault. I was the impact producer on Jackson, and I'm a journalist and work on film. Yeah.
Great. One thing, so I rewatched the film today, and one thing that I was just struck by is that this film came out in 2016, and yet it feels like it could have come out last week. I mean, the two major themes of the film, the Supreme Court case around admitting privileges, we were doing that last month, literally, and then the idea of states not having access to abortion, which is something that we've seen kind of come up with COVID-19. So Maisie, I'm really curious, 4 years later, did you expect this film to be just like so top of mind and so relevant the way it is right now?
When I finished making the film, I didn't, but I finished making the film before the current administration was elected to office. And I finished the film in a time where the Supreme Court had just ruled in favor of whole women's health. And it seemed like access to reproductive health care was moving in a direction of being more accessible. I really thought this film was going to be used to talk more about the Hyde Amendment. And then fast forward to later in the year, and Trump takes office, and I think you just really saw things escalate from there. And so, I don't think anyone could have anticipated this pandemic, but what I think was so clear to me as soon as the pandemic happened and states started saying, oh, well, abortion's elective, you can't do this, was that the anti-abortion movement is going to use any angle that they can, no matter what it is. They are always going to look for an in to limit access, whether it's on the sidewalk, whether it's through legislation, whether it's through, hiding behind emergency measures. So in that way, it doesn't surprise me.
Interesting. And so you started filming this, I believe, in 2012. Is that right?
I started filming in I think so. Yeah, 2012.
It's incredible. Just 8 years later, it's like so relevant. Again, like it could have happened yesterday. I'm curious, what brought you down to Jackson? What was the impetus for you?
I went to Jackson after reading an article in Jezebel about Jackson Women's Health Organization, the only abortion clinic in Mississippi, being in a lawsuit over whether or not they could stay open because of hospital admitting privileges. So a law had just passed, and the Center for Reproductive Rights was representing Jackson Women's Health Organization. So I read that article, got on a plane, and went down there. And I was really surprised to learn that in a place like Mississippi, really anywhere, that there would just be one abortion clinic in a state, and the driving distance to another one being so far away. It was really deeply unsettling to me.
One thing that I find covering abortion is that it's, it's often so much more different when you're on the ground as opposed to when you're reading about these regulations. So I'm really curious, kind of, you read this article, you read about the different restrictions. How did that play out when you were on the ground? Was it what you expected? How were things a little bit different when you saw it, playing out for actual patients at this actual clinic?
I think the thing that's surprising to me, and what I don't think I quite understood, is how intense just entering an abortion clinic, especially an abortion clinic in Mississippi, can be, and what women have to walk through to get there. And, since I started making the film in 2012, I think the first time I went there was a security guard in the parking lot fending off all of these protesters. And now there's, and even over the course of making this film, these amazing individuals stepped in to really act as the blockade between the protesters and the women entering the clinic. And so this entire support system has emerged over the past several years, and it's been amazing to see, because I had no clue what I was going to have to walk through. And the crazy thing is, every day, and I filmed for 4 years, every single day I would walk in that clinic, they would yell at me not to have an abortion, and they would forget that I had filmed them the day before. Because it wasn't about who I was as an individual or who anyone is as an individual. It's just like the people on the other side have one goal, and that is to stop a woman from accessing healthcare.
Now, was access to abortion something that you were passionate prior to the project, or did that kind of come as you were filming?
I think I always took it for granted. I was born in the 80s, and so I took access to reproductive health care to be something that everyone had. I was born in a pretty comfortable home to very conservative parents, so I had to access birth control on my own, but I had a Planned Parenthood where I lived. And it never really occurred to me until I was in my late 20s how scary things had actually become. And it wasn't until I got out of my own bubble, when I went to college and had a much better understanding of the world around me, how when you're a white woman who comes from some sort of means, you're always going to be able to access healthcare. So I think I became more and more, I cared more and more about access the older I got, and the more I understood how difficult it really could be for so many women.
The reason why I ask that is because in watching this, I was struck by a lot of different things, but the journalist in me was really struck by how well you were able to be so balanced about an issue that is, it's an issue that's tough to be balanced on. It's something you need to be thinking about all the time. So I'd love to hear a little bit about kind of your method and your process of, reaching out to the crisis pregnancy centers, giving them their fair share. And clearly they were very comfortable with you and they trusted you. So I'd love to hear a little bit more about how you were able to do that during the filming and then in your edit as well.
Yeah, I think with abortion in particular, I stand very firmly on the side that women should have control over their bodies, and they should be able to access the healthcare they need, and they should not only have a choice, but just a right to access that. And so for me, I don't know that there's like two clear sides, because I think it's pretty challenging, even as a reporter, to say that someone, say I need an abortion, that the person I'm talking to thinks that I shouldn't have it. But I think the journalist in me, in telling any story, is showing both sides, whether I agree with them or not. Because I think unless you have the full context of any situation and every side on that situation, then people aren't going to fully understand it. So for me, the balance wasn't hard to strike, because I felt people needed to understand how crisis pregnancy centers operated in order to understand why things were so dire. And when I went to the crisis pregnancy center, I was very clear that I would show them fairly, show them how they are. And I don't know, and I did. And they asked me what I believed, and I told them that I was pro-choice.
How do they take that? I'm curious.
Well, that was early on. I think that was the first day that I went in there. So
Okay.
it was constantly, I think it was constantly like this kind of like game for them to try and convince me to be anti-choice, you know?
Sure, of course.
At one point when I was in there, they were interested in knowing if I wanted to be a born again virgin. And I was not.
I understand you get close with the people that you film with, but that seems a little bit too personal of a question for a working relationship. I don't know.
Totally.
Did you run into other like kind of strange interactions like that when you were filming?
Yeah, I mean, always, because you never know what to expect when you're standing especially outside of the clinic, because there's always different groups of people coming there to protest. And so, yeah, you never knew what you were going to run into out there. But then I developed some really great friendships through making this film, I think closer than I've gotten to any other people I've ever filmed. I mean, the director of the abortion clinic is a woman who I care deeply about. And we just, I think, built a really strong friendship through making this film.
I'm curious why you think that is. I mean, is it just because abortion and access to it is just such a kind of intense topic, or why do you think that happened?
I think for a couple of reasons. I was filming far away from home, so I, didn't have any friends in Mississippi when I arrived. I mean, I made a lot of friends. And then Shannon is the kind of person that, like, once you get to know her, she's pretty like tough on the surface, but then once you get to know her, she really takes you in. And I don't know, in a way, especially when I was filming it, feel like I was equally as vulnerable with the individuals on the other side of the camera as they were with me. And it just was very much a bonding experience.
One thing I'd really like to hear about, and, both from the topic and then just like process is, I mean, the access in this film is incredible. I don't think I've ever seen, aside from my own reporting, an abortion clinic so up close and really seeing what goes on in there. And then in the same way, a crisis pregnancy center, so up close and seeing what's going on there. I'd love to hear a little bit about kind of your process, how you built those relationships. I mean, how long it took to get in those rooms and, kind of how that worked. It was very impressive.
Oh, thank you. With the abortion clinic, it was really just spending a lot of time and getting to know the staff and the doctors, and then working with women when they came in. So many days it was just sitting there, and the women come in for a counseling session. At least when I was filming, it was 24 hours. That was what the state mandated, 24 hours before their abortion was able to be performed. And the women are often counseled in a group, at least like the instructions are given in a group, and then they go one by one to talk to the doctor. And so I would kind of make my pitch when they would come into the counseling session and explain what I was doing, why I thought it was important, and that if they were interested in participating, they could let me know. And so I tried to be as unobtrusive as possible, but like be there, because so much of it, I get so many emails and so many calls about how to access, how to make a film on an abortion clinic. And all I can ever say is it's really just about spending so much time there.
Right.
And that was the same with the crisis pregnancy center, not really spending a ton of time there, but I sat in the lobby once they let me in and decided that I could film them as part of this film. I sat in the lobby and waited for women to come in and talk to them. And that's when I met April. I met April, I think the first day that I was filming there. And then she left, and I chased her out of the CPC to ask her if I could come to her house later and talk to her about the project, which is what I did. And then the first time, I haven't watched the film in quite a while, which is crazy. The first time that you meet April on screen, I think, is when she's walking into the crisis pregnancy center.
Mm-hmm.
And so that was when she went to the crisis pregnancy center to set up the appointment for the sonogram. And that was when she was going back for the sonogram. So I went back with her, obviously went in before her, and then filmed her walking in. To go
right, of course. Yeah. April is just such an amazing person, and just it's so complicated and layered, and just a really, really heartbreaking to kind of see how all of these state politics play out for this one individual. I mean, I'd love to hear a little bit more about your relationship with her and spending so much time with her and how that worked.
Yeah, I mean, it was similar to what I was doing at the clinic, in terms of just hanging out and spending a lot of time getting to know April, and hanging out to really find moments that captured her story. And the same, like I became very vulnerable around her, and I shared a lot about myself as well. And April ended up coming to the clinic at one point just to meet Shannon, because I had talked so much about Shannon, and she now has an apartment on her own with her kids. And yeah, I still keep in touch with them intermittently.
There was one thing I was just personally most excited to ask was, how is April doing now? And so it sounds like she's doing very well.
Yeah, she's in an apartment with her kids. Her kids are in school, and they're growing up. I mean, her situation hasn't changed that drastically. I mean, it's really challenging to raise 7 kids as a single parent in Mississippi.
Right.
So no, I think it's gotten much easier for her, but I think that hopefully she's more empowered now that she's moved out and is on her own.
Right. One thing I wanted to ask you, it was just a little bit more about kind of your thought process behind all of this. And I think we spoke about this before this conversation. I thought it was, and I think this is relevant. And it's that, a lot of people don't think about abortion unless they are maybe like a journalist or a filmmaker that cover an abortion clinic, or they have to have one themselves. They don't think about these restrictions. So I'm just very curious about kind of how your thought process around abortion, how it's regulated. How did that change after spending, 4 years on the ground in Jackson?
I know, I can't even remember how I answered when you asked me that the other day. I'm trying to remember, because now, of course, I've been reading so much in the past few days about what's happened currently. I mean, I think I took for granted access and what access meant and how one goes about achieving access, and that it's contextualized by the way we were raised and by the access that we have to so many other things. So I think my biggest takeaway after making the film was just how complicated access is and how different it is for each individual based on their income, their location, their race. I mean, there's so many factors, and it's just healthcare isn't equal in this country. And access to abortion care is certainly not equal. I mean, I worry that it's going to be a patchwork system again, where you have some states that offer abortion care and other states that don't. Right now, I know at certain points during all of this pandemic, some women from Texas, which is where I live now, I live in Texas, have been having to drive to Colorado, I've heard, just to access care. And just even thinking about what that means, driving from Texas to Colorado to access healthcare during a time when you're supposed to stay home. I mean,
right. Yeah. And to me, that almost brings up 2 major themes of your film, which one is just access, like simply if abortion is not available in Texas, like it wasn't for the past 4 weeks, you have to go somewhere else. But then second, the stigma of it all, right? Like if there is a healthcare procedure that you want to have, but the state is telling you, okay, that's fine, but you need to travel 15 hours, inherently, you can't help but feel like, well, why can't I get this in my own state? And so I think that to me speaks so much to kind of the stigma that surrounds abortion in so many of these areas where politicians have been hostile to the procedure.
Sure.
And I thought,
yeah. Well, and just even thinking about how difficult in some states it can be to access a pill abortion, where really, I mean, you shouldn't even have to go into a clinic. You should be able to do it via telemedicine. And that certainly during a time like this, if you're a candidate for a pill abortion, you should be able to stay home when we've been getting these, we've been getting elected officials telling us we need to stay home. Yet they're not making abortion accessible at home when really it could be, and it should be, especially right now.
Right. And if anything, if I'm not mistaken, a lot of politicians have actually clamped down on telemedicine abortion during the COVID-19 pandemic. I mean, they would argue because if something goes wrong, you have to go to an ER. So it is interesting in these moments of a public health emergency and a national emergency, you aren't seeing what could improve access. You're really seeing the opposite.
Totally. And I have no clue. Like, I don't know, I know that the whole time I was filming in Mississippi, I never heard of one patient having to go to the emergency room at Jackson Women's Health Organization. And so, I mean, that's a 4-year span. So I can't imagine during these 6 weeks that there would be some massive spike in women needing to go to the ER if they were given actual access to their healthcare.
Right. And then that, of course, speaks to admitting privileges, right? The whole idea that if a doctor, so for people who aren't watching, admitting privileges are a little complicated, but basically the way it works is that if you are a doctor who provides abortions, if something were to go wrong, if you have admitting privileges, you would be able to admit your patient directly to a hospital. So in states like Mississippi, they would pass these laws saying if you're a doctor that provides abortion, you need to contract with a hospital within 30 miles and you're put to your clinic. Obviously, like you saw in the film, the problem is that a lot of hospitals don't want to contract with an abortion provider. But it's interesting because you're seeing this now all play out a whole second time in Louisiana. And to your point, that one clinic in Louisiana that's the plaintiff in the Supreme Court case that we saw last month, again, they told me in 20 years, they've seen 4 patients that have had to go to the hospital. And I think it kind of spoke to something, and what I really appreciate about your film is that you can take these laws at face value, but then you had a great way of showing how these laws play out. So you saw the doctor opening the letter that says exactly why you can't have admitting privileges. So I thought it was really a great visual way of showing how these restrictions really play out for the actual patients and the doctors.
Thank you. Yeah.
So were there any other, sorry.
No, what were you going to say? Sorry.
I was going to ask, I mean, Mississippi has, of all the different abortion restrictions that states levy on patients and doctors, I think Mississippi has nearly all of them in some way, shape, or form. It's one of the most restrictive places in the country to get an abortion. I'm curious if, as you were filming, were there other kind of regulations that you saw playing out that you wanted to look more into, but just didn't have the space and time?
I mean, when I was there, we were kind of following this law, the admitting privileges law, because it kind of in the background of the film, right? Because by the end of the film, you have Whole Women's Health at the Supreme Court. And so, yeah, I question the majority of weird regulations that I saw the clinic having to meet. I thought the 24-hour waiting period, and in some states, I know in some states it's up to 72 hours, just seemed so extreme for me. I think maybe I would have taken it for granted before I started spending a lot of time at the clinic, but having a woman wait any period of time when she knows what she wants to do seems unnecessarily restrictive. A couple years ago, I did a piece for The Intercept, actually back at the same clinic in Mississippi, where I followed a woman who I met at that clinic. I met her the day she came in for her counseling for a pill abortion. She had saved money to drive to Mississippi to have it. She then had to get a hotel room to stay overnight, to wait the full 24 hours, to then go back in and literally swallow a pill in front of the doctor. I mean, with that kind of, with a pill abortion, if something was going to go wrong, it's not in swallowing the pill. It's going to go wrong when you're already back, waiting for the abortion to happen. And so that seemed so, I was really upset by that. I think that was one of the more upsetting things, was to see this woman have to spend so much money, have to struggle to pay for a hotel room, to pay for food, to pay for a taxi, to pay for a bus ride to and from the clinic, all to swallow a pill in front of a doctor, when really she could have just gone to her pharmacy down the street and, you know, given them a prescription for the pill. And so that, to me, I think it wasn't until then that, and following that process with her, where I was just, it made me very, very mad.
Right. I think waiting periods are interesting because they are one of those restrictions that I think sometimes people read about that and will think like, well, that seems reasonable. Like, you know, you're about to make a big decision, like you would normally sleep on it. And then it's when you see it play out in real life, it's so the reality is so different than the kind of a simple like, oh, we'll just sleep on the decision. I worked on a piece for CBS Evening News about in Missouri, which is similar to Mississippi. They only have one clinic. It's in St. Louis. And we followed along with this woman who she lived, I think it was like 4.5 hours away from St. Louis. And that was the closest facility to her. And it was just like, it really, even I, as someone who reports on this all the time, it was so striking to watch someone. And she was, you know, she was gracious enough to let us come back and forth with her. So, you know, we did the drive with her. We saw how long it was, how expensive it was, filling up the car, all of these things. And it was just, it is one of those regulations where until you see it, you know, happening and in real life, it's hard to strike home. So I'll have to check out that piece of yours. I haven't seen that one.
Yeah, please do.
But Abbie, I also wanted to ask you, I feel like we haven't heard too much from you. So how did you get involved with the project?
I came onto the project when it was in post-production, so a little later on, but I worked on the impact campaign, so structuring these events around the film and linking it with activists and different school programs and places all over the world, actually. And it was so amazing to, I mean, it's a little depressing to know that everybody's going through the same problems with more restrictions being put in place across the world. But it's a nice way to unite different communities around these topics. So that's how I got involved in Jackson. Yeah.
That's so cool. I would love to hear a little bit about, you know, one thing that you touched on in the doc was about, you know, the lack of sex education and how that plays into how people access abortion. So Abbie, I'm so curious, like, how have you worked with schools to, you know, get them to watch the film and, you know, have it be impactful?
A lot of times we were linking with student organizations that were working around reproductive rights, whether they were doing like clinic escorting or activist work around those topics. So it was easy to find that, but then there were also more general, like just universities that were wanting to talk about a topic that's often taboo and it's, you know, it's stigmatized and uncomfortable to talk about a lot of the times. And I think it's so great to have places want to open that conversation a little more.
Absolutely. Have you seen, I'm curious because of course this documentary came out prior to Donald Trump's election presidency, which really, understatement, really changed how Roe v. Wade is secure. And so I'm curious if after that election, kind of how did this film take on a different life? Did it?
Yeah, it completely changed. Yeah, that we were putting this film out there to people, and Maisie can talk more to that. But
I was just going to say, I don't think it, so it did the festival circuit before Trump was elected, but it didn't air on TV until after Trump was elected.
Mm-hmm.
So,
oh, how interesting.
I know. So it took on a much larger, I think, significance and certainly, I mean, it was important when I made it, but it was just as important and I think more important after Trump was elected, because I think access to abortion care, when I would tell people, I remember telling my husband like how different things were in Mississippi than at the time we lived in New York, and he's from New York. And after filming in Mississippi for 4 years, I was not surprised to see Donald Trump win. And I remember my husband being really shocked that Donald Trump would win. And it was, I had been seeing so many of these extreme legislative measures that now I think the whole country is seeing play out in one state. And I think all of a sudden Mississippi became like kind of a symbol for what could happen and was going to happen in many other places once the administration changed.
That's very interesting. What are some of those things that you've seen play out? I'm curious.
I mean, I think a lot of the same restrictions on abortion care. I don't think that if a different individual was in office, we would not be seeing these extreme limitations on access during a pandemic, especially across the country. And I think that we'd, be seeing the Supreme Court rule in different ways. I just think it's been kind of a domino effect of things that have happened. And I think it's happened in some cases slow, pretty slow over 4 years. Because if you would have told me 4 years ago where we would be today, I would have said, no way. That's not even possible. Even though
Right.
it's totally possible for him to be elected, I wouldn't have even began to imagine how different things would be.
Yeah. And I think it's interesting because we so often talk about like the different restrictions or, how they go up to the Supreme Court. But for Texas, recently, the Attorney General restricted abortion for about 4 weeks. That was mostly held up by the Fifth Circuit and a Donald Trump appointee judge. And I think what sometimes can get lost in the conversation is that this isn't just about the Supreme Court picks. This isn't just about those, those 2 new seats in the Supreme Court. This is about nearly 200 new federal judges that the Trump administration has put in place that have dramatically altered the way abortion is accessed. And, Texas, of course, is a gigantic, big, huge example of that. But it's also in all sorts of different smaller restrictions that might not be on people's radar. So the Fifth Circuit has, that's Mississippi, Louisiana, and Texas. And there's many laws that are actually in effect in Louisiana and in Mississippi that the Fifth Circuit has held up. And the Fifth Circuit is also the reason why we're back in the Supreme Court. So, I think we so much talk about all these different restrictions, but it's really these judges and the judge picks too that make a gigantic difference for abortion access, which
Totally
can happen very quickly.
Completely.
Yeah.
I think another thing about the Trump presidency is just how it's empowered some of those voices. Like clinic protests have only increased in the past 4 years, and people feel empowered to talk about controlling women's bodies in a more overt way right now, I think.
That's a great observation. I was talking to the president of the National Abortion Federation recently, and they're one of the only groups that tracks violence against abortion clinics. And they were saying that just since you saw Trump get elected to president, it's just been like parabolic the number of instances of harassment, violent threats, and then getting worse. Like shootings, things like that. And these things do happen, arson. And you've seen an increase. And I asked her why she thought that was happening. And the way she explained it was that when you have, it's one thing for like kind of smaller fringe groups to use some of these like, I don't want to use this word, but like triggering language. So some of the really, kind of more graphic language that, anti-abortion protesters can use. But when you hear the president of the United States use those same words in a tweet, for example, it really, I don't want to say it gives permission to those people. I think that's too strong, but it does validate, if they were thinking something, okay, well, the president of the United States apparently feels the same way as I do. Maybe I should go head over to the clinic and do some protesting, or worse. It takes you to that next level.
Totally.
But it's just interesting.
And I wonder, there's I know when we signed on, there were 2 people in the chat, in this, in the crowd, who are who are escorts. They're clinic escorts, and they basically are the line between the women and the protesters. And I don't know if they can shed any light, because I know things have changed there, and I haven't been, during the pandemic. I mean, I haven't been to Mississippi in a couple of years. And so I'm just very curious what it's like on the ground right now.
Yeah, that would be great if they could tell us that in the chat box. That would be really cool. In the meantime, while we're waiting for them to type that, I would love to kind of go over a couple questions that people have asked, if you guys are okay with that.
Yeah.
Cool. Okay, so the first question I have is, I think we've already answered this, but have you been back to the clinic and have you checked in with April? So I guess, how often are you back at the clinic?
I mean, I was back I can't even remember now when it was. Maybe like 2018 or 2019. Abbie, do you remember?
For the intercept, I think it was 18 or 19.
Yeah, I think that was the last time I was there. And I went back to short. And April checked in on me most recently when everything went into lockdown, just to
that's great.
see how I was
doing.
Really
nice. Next. Sorry.
Oh, and then I was just going to say, and then I texted Shannon to kind of get an update right before, we were doing this, just to make sure I knew the latest of what was happening there.
This one is from Sabrina. She says, great documentary. Thank you so much for your work. Wondering if including the stories of people actually getting an abortion was considered, sort of a la After Tiller. I was struck by how the CPC rhetoric failed to capture the complexity of reasons why people seek abortions.
So I made another short before this film, before Jackson, and it was also at that clinic. It's called The Last Clinic, and it followed a woman seeking an abortion. And when I decided to make this film, I think the thing that struck me and the thing that kind of always stayed in my mind was not why women seek abortion care, because I think the reasons are endless. And I guess I was at the point where it didn't matter why someone would want an abortion. What mattered is why someone couldn't access that abortion. So that's what I wanted to be about. I felt like there was enough work out there really explaining well, like After Tiller, why women might need an abortion. And like I said, the list goes on, and I don't think there's any wrong reason for needing an abortion. So I really wanted to take the opportunity in making this film to show what kept women from being able to access abortion care if it was something they wanted.
So to you, this film was very much about abortion access.
Yes.
I think this next question is very similar, but what was your ambition with the film when you started the project? Did you take into account that it could be used as an advocacy tool? That's from Mariana.
Yeah, I would not consider myself an activist. I would consider myself a person with strong beliefs who operates within the realm of journalism. I mean, that's kind of always been my career in one way or another. And so when I made this film, of course, I thought it could be used for advocacy, but I didn't specifically want to make an advocacy film. I wanted to make a film that showed the truth of what was happening and then give it a life of its own and allow, groups and individuals to take it and use it for how they saw fit. I mean, I feel like I put what I saw out in the world and hoped that it was enough to start a conversation.
Great. I mean, that was one thing that I was, I think, most impressed with and struck by was the great balance that you were able to achieve. Just giving both sides their fair say, showing people very accurately. And then, I mean, I think abortion is difficult to cover without getting into one way or another because people are so passionate about it. And sometimes it feels as if including I think there are some anti-abortion advocates who can rely on disinformation and things that aren't factually accurate. I mean, this is a question for me. How did you get around that? Because I do find that I experienced that as a reporter, and then I don't know kind of how to handle it. So I'm curious about that.
Yeah, I mean, again, I feel like my responsibility as a filmmaker is to show, right? Like all of us have our own truths and our own way of seeing the world. And so this was the way that I saw the situation happening. I mean, after 4 years, it's hundreds and hundreds of hours of footage and all sorts of stuff that's said. But at the end of the day, I pulled in what encapsulated my experience as a filmmaker in Mississippi, trying to answer the question of why is it so hard to access an abortion?
Right.
And so, I think as long as it was truthful, and it helped answer that question, then, it was probably going to be in the film. And truthful in terms of like, because I think they're obviously, I guess I call Barbara out when she says,
that was the moment that I was thinking about. Mm-hmm.
Right.
Yeah.
So, I mean, if I know for a fact that someone is providing misinformation, I'm not just going to I'm certainly going to put it in the context of like, this person is definitely saying something that is not true,
Mm-hmm. That makes sense.
And so that was, I think, one of the few times that you hear me speak up in the film.
Right. And that's what I was curious is it was striking to me to kind of hear a producer voice to say something that was calling out something that just wasn't true. So I was curious if that was something, we saw that instance once, wondering if there were more instances like that where you kind of had to jump in or were like kind of flagging certain things as like, that's not true. So is it useful to use that?
Yeah, I mean, I think anytime I interview someone, if they're telling me something that's not true, that I know, like that I can state the actual fact to them, then of course I'm gonna go there. That's just who I am as a person and as a journalist. So yeah, I'm sure if like I looked back through a raw interview with Barbara, there were probably many occasions where I was like, no, that's just not right.
Right. Are you still in touch with Barbara?
I have not talked to Barbara in a very long time.
Okay. One thing that you touched on in that last answer that I would love to dig into, before this conversation, I spoke to the president of Whole Woman's Health, which is, for those of you who don't know, like a clinic, a network of clinics that provide abortion in Texas, Indiana, Maryland, a few other states. And I was asking her about what she thought about what was going on in Texas with the abortion bans for coronavirus. And she was like, look, I'm not going to give you an opinion on this, but here's how I view it. I do the exact same procedure in Maryland that I do in Texas. And for some reason in Maryland, it's an entirely different process than when I do that same procedure in Texas. You tell me why it's different. So you spent 4 years trying to figure out why is it so difficult to get an abortion in Mississippi. So what's your conclusion from that?
You're asking me, or I?
Yeah. Yeah.
I was listening to her answer.
I do think there's a really good part in the film that Maisie put in there about, let's see what part. Maisie, what were you going to say? Let me think about it.
Wait, just rephrase the part that was the question of.
Oh, yeah. I think it was just, and this is something I think a lot of people who work in this space grapple with, is why is abortion so difficult to access in one state compared to another one? So, after spending 4 years, yeah.
I mean, because of the decision in Roe v. Wade, right? That leaves it up to the states to decide after the first trimester. I could be wrong. I mean, I don't know.
Oh, I'm sorry. This wasn't a quiz. I was just curious if like culturally you saw something.
I think that it should be regulated federally instead of at a state level, access to abortion. And I think that until it is, and until something is decided at the Supreme Court level, right now, it's the way it was left to be determined by the states is very open. And
Right.
I think it's Roe, not what is the other case?
Oh, Planned Parenthood v. Casey.
Yeah.
And that one's
Which,
undue
is it that one?
burden.
Right. So I guess they both kind of leave,
And I think in
leave
the
it
film,
open for interpretation.
yeah, in the film you see the part where Dr. Parker is required to tell them about breast cancer being a risk after an abortion, even though there's not scientific evidence for that. And that just shows you that those are choices being made on a political level that have nothing to do with healthcare inherently. And I think that part of what you're saying is like so much of it is political and historical and cultural, state by state, different cultural values, especially in Mississippi. There's such a deep history of discrimination happening there. And like, how does that play out even in like this one aspect of like women's healthcare? It's still there. It's a part of the story.
One thing that we haven't spoken about that I would love to ask you about is kind of how race plays into abortion access, especially in a place like Mississippi. I mean, how did you see these abortion restrictions particularly impacting, people of color?
Oh, I mean, like, I think one thing that's interesting that people don't talk about enough because it seems so minor, but it's actually huge, is that at least when I was making the film, doctors who performed less than a certain number of abortions per month, I think it was like 5 abortions per month, didn't have to report the numbers. So that meant that a doctor could do that in their office, not claim to be an abortion provider, and not have to follow any of the regulations. And so that right there, like if you have a healthcare provider that you're able to see regularly who would perform that service for you, then you don't have to deal with any of the hoops that other women who would be going to the abortion clinic have to jump through. And that right there just like is so illustrative of the disparity, I think.
So someone who already has health insurance, a regular OBGYN, then can just go to their normal doctor as opposed to having to go to, Jehu and deal with the protesters and deal with all of that.
Totally.
Okay. So that's a completely different healthcare delivery.
Yes. Although it's state by state, I think, in terms of what your insurance will cover for abortion care.
Right. And if I'm not If I'm not mistaken, in a lot of these states like Mississippi, Louisiana, Texas, they have very heavy restrictions on whether or not your insurance can handle it, even though, or I should say, even if your insurance has nothing to do with the government, it is just like simply through your employer, which is pretty remarkable. I have one more question that I did want to make sure we got to Abbie. This person asks, in which places have you, so they were asking about how abortion access plays out in different countries. So they ask, in which places have you shown the film, and has there been a relevant international interest and response to the story?
Yes. One place that I thought was really interesting and pertinent was people began requesting to show the film in Northern Ireland, and they've long had different laws than the rest of the United Kingdom. And they had important decisions coming up in their court system around abortion. And so people were organizing screenings over that time just to raise awareness and like let people know like what is it like. And even if it's in the middle of Jackson, Mississippi, it's something that's very familiar to them of like, England can go to a clinic and people in other parts of the UK just can't. And they're, I think this plays into the cultural aspect as well, is that like if you're wealthy, you can travel. And so it's never a problem. Like a wealthy woman can always get an abortion. And that's just the truth. Like if you have access to travel to another country and take the time out of your life and step away to do that, that's a complete disparity. And it's happening more than just in the United States.
Yeah, I actually have a documentary coming out about El Salvador's abortion ban, and one thing that we found when we were down there was that they have a complete ban on abortion. Nothing's allowed, not even if the woman's life is at risk. So just complete ban. I think it's one of the most like restrictive countries in the entire world. But what we found was that we were talking to these, women who often lived in rural areas, very, very low income, just very intense poverty. And, they were the ones who were in jail, who were getting interrogated by the police about potential abortions. But yet when we spoke to this group of women who were very wealthy, we asked them, like, and obviously they would never say if they had one, but, we were asking, have you had a friend that's ever had an abortion? Like, how does that work? They're like, oh yeah, no problem. We just go to Mexico City. We can just go to Miami. And so it's like what people say. It's like when you ban abortion, it doesn't stop abortion from happening. It just makes it a much less safe and for some of the most vulnerable people in your population. And no matter where you are in the world, whether you're in Jackson or Northern Ireland or in El Salvador, it doesn't really make a difference. I have one more question that I was hoping to ask you. And it is from Tara. She says, thank you for presenting such an even-handed narrative. Flip Benham from Operation Save America, formerly Operation Rescue, appeared in the documentary a couple times. Did you have any interactions with him?
Yeah, I did. Really just I think he was in Mississippi when I was filming that for like a week. So when you see him, no, it's a couple of different times. I don't know. He never remembered me, but I did do an interview with him. And then at some point while we were making the film, I think he left Operation Rescue.
Oh.
Right. I mean, I think he was like the leader of it. And then eventually he left and someone kind of moved up the ranks. And of course, now there's other groups that I think have become much more, much more aggressive or just as aggressive as Flip was. I feel like when I started making this film, Flip was kind of like leaving his career of protesting outside of abortion clinics.
Okay. And then for context with the audience, if you're not aware, that's a very important organization because if I'm not mistaken, they were for Dr. Tiller's assassination. They weren't responsible. They didn't take credit for it, but it appeared as if the person who assassinated him was involved in some way with that group. So kind of, I think that's probably why they asked, because that group is much more than just a sidewalk protesting group. This is a group that is violent. So just something important to know.
Before a lot of laws happened, I think in the late 90s, they were much more aggressive. They basically always pushed it as far as they could until certain things became felony charges. And then of course he was also, I think, responsible for converting Jane Roe, right?
I believe so, yeah.
Yeah.
But I'm not.
No.
Yeah, it's interesting because in my reporting, and you touched this in the doc briefly, but those people don't consider themselves protesters, right? They would say that that's not what they are. They would call themselves a sidewalk counselor. But I do find it interesting in reporting. It's like, there are two kind of different people who are outside of a clinic, and they're kind of the sidewalk counselors, the protesters, and then there's kind of this other underbelly. And I do want to ask you about this, and that's the Operation Rescue, the kind of the more violent group. So was there any moment that you were nervous or afraid or had any kind of safety concerns when you were filming this?
Yeah, I think, tensions were certainly heightened when the cameras got torn down at the clinic. And that was super scary. And, Operation Rescue, the way that they work, or the way they worked when I was making the film, is they travel around the country and really descend on clinics and try and cause as much chaos. And the cameras, the clinic was vandalized and the cameras got ripped down, I think right before Operation Rescue or Operation Save America was coming to Mississippi. And so I
Okay.
just remember it feeling very, yeah, I was scared.
Were you?
And, you know, there was one time I was filming at the clinic where the tire, this is so weird, the tire was cut off my car. The rim was left there, but the tire was gone when I got back to my car.
That's very intimidating.
It was weird, yeah.
Yeah.
I mean, I don't know. I remember when I went to get a new tire and I like brought in my rim, they were so confused about what happened.
I mean,
yeah,
maybe
yeah. And the thing that I think, you know, is like anything, when you work in a very high risk situation like Shannon does, it's like, I think you're like, oh, okay, I feel safe, I feel fine. And then you start to slowly take things for granted or your safety for granted, because everything seems okay. And you're like, oh, well, those are just people that yell at me every day. I can learn to tune them out. And then the clinic is vandalized overnight. And then all of a sudden it's like, you have to remind yourself it's not safe.
Right.
And it's not safe for any of the people that work at the clinic or that are sidewalk or the patient escorts. Like, you know, they put themselves out there and I think are constantly, you know, they're constantly the target of harassment.
Right.
I mean, to the point that one thing that that struck me from when I finished making Jackson to when I went back when I was filming with The Intercept, is that over that time span, some of the protesters would show up wearing clinic escort vests to try and confuse the patients going in. And that, to me, it's like they take it to a level of just like anything they can do to upset or confuse a woman trying to access abortion care is what they're gonna do.
Yeah, that is, I'm struggling for the right word. That's very, it's one thing I struggle with when I cover this, and I cover this every day. And it's, you know, sometimes, you know, they don't want to be called a protester. You know, you have to call them by what they want to be called. But then something like that will happen, and it feels very, you know, if your intention is to truly do what you say you're doing, your actions aren't always reflecting that. And that's kind of, I find to be one of the most difficult parts of covering this beat is, you know, I want to believe the best in people. If you tell me that that's how you feel about something and you're just trying to help people, like, okay, like I'll believe you until you show me that maybe I shouldn't. And doing something like that, you know, wearing the clinic vest feels, you know, it's almost like a breach of trust. Just
It's totally
when you want to trust someone, it absolutely is. And it's like when you want to trust someone, if you're a filmmaker and you want to trust these people, like, okay, like I'll give you the benefit of the doubt. It's hard to keep doing that.
Yeah, and I think
it
that
seems
was,
obvious
you
they're
know,
looking at them.
people always ask me about like filming Barbara and about filming the anti-abortion side of things. And it was eventually you just get so exhausted of catching people in a lie over and over. And you're like, you know what? Like, I'm going to show what you're saying, but like, I have no problem being very clear that you are either grossly misinformed or you're deliberately misinforming other people. And I don't have a problem showing that to the world, you know?
Right.
I mean, people have to be called out when they are intentionally giving misinformation to individuals seeking healthcare.
Mm-hmm. And I think, you know, kind of circling back to the beginning of this conversation, that is certainly, I think, one of the strongest pieces of Jackson is that, you know, you don't come at it there. It's very clear. It's very balanced. You're not coming at it from a certain point of view. You're just given all the information, and everyone is able to say what they want to say. And it really leaves it up to the viewers to say, like, okay, here's the full picture of what it looks like for a patient to access abortion in Jackson. And, you know, it's up to you about how you feel about all of that. So I think it's certainly, you know, I'm sure it's frustrating at the time, but I do think it's probably one of the most powerful parts of the film. But,
thanks.
I think we're like right at an hour. So, I mean, I guess just any final comments before we sign off for the night?
I mean, I'm excited to see your documentary. So
thanks.
Keep everyone posted for when it comes out, because you know, I think I'm really glad that there's so much work being done on this topic right now. I think it's It's just really important.
Yeah. I had seen your doc when it came out, and then another time. And then watching it today was kind of the first time I've seen it since I started covering this issue. And it was professionally, and it was so striking and so amazing. Like, this film has not aged. It is just as relevant today and just as important and just as incredible as it was, 4 years ago. So thank you so much for putting together, for better, for worse, such a timeless piece. So thank you so much.
Thank you. And yeah, it's too bad that it's still pretty timeless. I think I wish, hopefully it will become something where, if I have a child, they'll look back and be like, what? That was how it was.
Yeah.
But yeah. And so, yeah, thank you everyone for joining in and being part of the conversation.
Yeah. Thank you so much for everyone for joining. This was a great conversation and some really great questions.
Thanks so
I
much.
guess I'm not sure how to sign off.
Coming back up. Thank you so much for joining us, guys. That was such an amazing conversation, and obviously such an important conversation to have always, but especially in light of the global situation. You can find more information about the film and about how to act on our website at stayhomewatchtogether.com. Please also check out the other amazing films that we have coming up that need your love and support, and spread the word on social media with the hashtag stayhomewatchtogether. So thanks so much again for joining us, and we'll see you all soon.
Thank you.
Bye.